Calgary Mountain View.
Thank you very much, Mr. Speaker. All of us in this House are acutely aware of the skill, compassion, and courage of our emergency responders and of all the people in Fort McMurray. Through the heart-raging inferno, also inspiring are the thousands of ordinary Albertans who've given time and money to support their neighbours. But mental health and supports for mental health are an ongoing concern. To the Minister, how in a mental health system unable now to meet the needs of the population is the province planning to see the needs of these people?
Thank you, Honourable Member. Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the question. Certainly appreciate his dedication and commitment towards the mental health and wellness, both of the evacuees as well as the first responders. And certainly when I was at the Western Premiers Conference just late last week, everyone wants to help us, not just the Western Premiers, but Canadians want to help us, and finding ways that they might be able to provide some support in the days, weeks, and months ahead is certainly something that they're interested in supporting us with. But it will be about triaging and making sure that we get the resources where they most need to be. Again, please register with redcross.ca.
First supplemental.
Well, again, Mr. Speaker, we're talking about resources that are already insufficient. Where are we going to get new resources, and are we committed to new resources? First responders, given that first responders in Fort McMurray have unique trauma associated with some of them leaving their families at the very time when their families need them the most, what new resources, including qualified trauma specialists, will be available?
Great question. Honourable Minister.
Thank you very much, Mr. Speaker. And certainly there have been discussions with Alberta Health Services about the resources that are available currently, what the response was in some of the other natural disasters that we've dealt with recently, how those might be able to apply, as well as ways that we might be able to collaborate with federal government as well to release some resources. For example, the trauma that some of our first responders are dealing with is unique in this situation, but it happens on a regular basis as well with armed forces. So we're certainly in conversation about ways that we might be able to use their expertise as we move forward, Mr. Speaker.
Second supplemental.
Well, thank you, Mr. Speaker. Given the concerns about the lack of trauma-trained counsellors in the province, including our WCB, Workers' Compensation Board, for PTSD, and its capacity to deal with increased numbers of first responders, can the Minister tell this House what new staff and resources will be provided for this extensive population of traumatized people?
Honourable Minister.
Thank you very much, Mr. Speaker, and to the member for the question. Certainly the Chief Medical Officer of Health is an instrumental part of making sure that we move forward with evidence-based decisions, looking at what the needs are here in Alberta and also what best practices in other jurisdictions. I appreciate the suggestions that have been offered by the member opposite, and certainly have an open line of communication. But clearly, we will be caring for the heroes who are caring for us today in the days ahead as well, Mr. Speaker. Thank you.
Member for Calgary East.